Is the prostate of men who masturbate regularly any different from those who don't? This question might seem personal, but understanding how certain activities affect prostate health is important for many men as they age. The prostate is a small gland about the size of a walnut located just below the bladder. It produces fluid that nourishes and protects sperm. As men get older, the prostate often becomes a source of health concerns, from enlargement to more serious conditions like cancer. That's why knowing how your everyday habits might affect this small but crucial gland can make a big difference in your quality of life. Many men wonder if sexual activity, particularly masturbation, has any impact on their prostate health. The answer might surprise you. According to several scientific studies, regular ejaculation, whether through sexual intercourse or masturbation, appears to have protective effects on the prostate. Research published in prestigious medical journals suggests that men who ejaculate more frequently may have a lower risk of developing prostate cancer compared to those who ejaculate less often. One notable study followed almost 32,000 men over 18 years and found that those who ejaculated 21 times or more per month had about a 20% lower chance of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. This finding has been supported by other research as well, suggesting a consistent pattern. But how exactly does ejaculation benefit the prostate? When a man ejaculates, the prostate contracts and expels prostatic fluid. This process helps flush out potentially harmful substances that might otherwise build up in the prostate ducts. Think of it as a natural cleansing mechanism for the prostate. Over time, this regular flushing may help prevent the accumulation of substances that could contribute to inflammation or even cancer development. Additionally, regular ejaculation might help reduce prostate inflammation. Inflammation of the prostate, known as prostatitis, can cause pain and discomfort. By regularly clearing out the ducts through ejaculation, men might reduce their risk of developing this uncomfortable condition. It's also worth noting that regular sexual activity, including masturbation, promotes better blood flow to the pelvic region. Improved circulation can benefit the prostate by ensuring it receives adequate oxygen and nutrients while efficiently removing waste products. This improved blood flow might contribute to overall prostate health and function. However, it's important to understand that while research suggests benefits, the relationship between ejaculation frequency and prostate health isn't entirely straightforward. Individual factors such as genetics, overall health, diet, and exercise habits also play significant roles in determining prostate health outcomes. What works for one person might not work the same way for another. So how often should men masturbate for optimal prostate health? While that study mentioned 21 times per month, there's no magic number that works for everyone. The key seems to be regular ejaculation rather than hitting a specific target. For some men, this might mean a few times a week, while others might find different patterns work better for them. What matters most is finding a natural rhythm that fits into your life without causing stress or becoming a burden. Beyond possibly lowering prostate cancer risk, regular masturbation offers other health benefits worth knowing about. For men who deal with prostate enlargement, also called benign prostatic hyperplasia or BPH, regular ejaculation might help ease some symptoms. BPH is very common as men age, affecting about half of all men by age 60. The enlarged prostate can press against the urethra, making urination difficult and uncomfortable. Some research suggests that regular ejaculation may help reduce pressure and swelling in the prostate, which could ease these bothersome urinary symptoms. By keeping fluids moving through the prostate, masturbation might help prevent the gland from becoming congested and swollen. Masturbation can also help men become more aware of their bodies and notice changes sooner. This increased body awareness might lead to earlier detection of prostate problems. Have you ever noticed changes in how your body feels or functions after not having sexual release for a while? This kind of self-awareness can be valuable for spotting potential health issues early. For men who struggle with painful ejaculation or discomfort in the pelvic area, regular masturbation might actually help reduce pain over time. This happens because ejaculation releases tension in the muscles around the prostate and pelvic floor. It's similar to how stretching tight muscles can bring relief. Regular ejaculation helps keep the pelvic muscles from becoming too tense. There's also evidence suggesting that regular sexual activity, including masturbation, might help maintain erectile function as men age. By keeping blood flowing to the genital area and exercising the relevant muscles and tissues, masturbation may help preserve sexual function. Think of it as use it or lose it. Regular activity helps maintain healthy function. It's worth noting that masturbation triggers the release of endorphins, which are natural mood boosters. These feel-good chemicals can reduce stress and promote relaxation. Since chronic stress can negatively affect all body systems, including prostate health, anything that helps manage stress can indirectly benefit the prostate too. Despite the potential benefits, there are many myths about masturbation and prostate health that cause unnecessary worry. Let's clear up some of these misunderstandings. One common myth is that masturbation causes prostate enlargement. This is simply not true. Prostate enlargement happens naturally with age and is not caused by how often a man masturbates. In fact, as mentioned earlier, regular ejaculation might help manage some symptoms of an enlarged prostate. Another widespread misconception is that frequent masturbation leads to erectile dysfunction or makes it harder to maintain an erection. Research does not support this claim. If anything, regular sexual activity, including masturbation, might help maintain erectile function by keeping blood flowing to the genital area. Problems with erections are typically caused by other factors like poor blood flow, certain medications, or health conditions such as diabetes or heart disease. Some men worry that masturbation will deplete their testosterone levels. This concern is unfounded. Short-term studies show that avoiding ejaculation does not significantly increase testosterone levels. While there might be a small temporary increase in testosterone after several days without ejaculation, this effect is minor and returns to normal quickly. Regular masturbation does not cause any lasting decrease in testosterone levels. There's also a myth that masturbation can cause prostate cancer. This is the opposite of what research suggests. As discussed earlier, studies indicate that regular ejaculation might actually lower the risk of prostate cancer, not increase it. This protective effect is thought to come from regularly clearing out potentially harmful substances from the prostate. Do you want more health advice like this? Hit subscribe and let's optimize your health together. Many people believe that the benefits of ejaculation for prostate health only come from sexual intercourse with a partner, not from masturbation. This is incorrect. From a physiological standpoint, the prostate doesn't know the difference between ejaculation from masturbation or from intercourse with a partner. The potential health benefits come from the ejaculation itself, regardless of how it happens. Some men have heard that masturbation can lead to prostatitis or prostate inflammation. In reality, the opposite might be true. Regular ejaculation helps flush the prostate, potentially reducing the risk of inflammation. Prostatitis is typically caused by bacterial infections or other health issues, not by masturbation. Have you ever heard that there's a right or wrong frequency for masturbation? The truth is that there's no single correct answer that applies to everyone. Each person's body is different, and what feels right can vary based on age, health status, and personal preference. The key is finding what works for you without causing physical discomfort or interfering with daily life. While masturbation can offer potential benefits for prostate health, there are situations where men should be careful or seek medical advice. If you experience pain during or after masturbation, this could be a sign that something isn't right. Pain might indicate prostatitis, a urinary tract infection, or another health issue that needs attention. Don't ignore this pain or assume it will go away on its own. It's better to talk to a doctor about these symptoms. For men who have been diagnosed with certain prostate conditions, the advice about masturbation might be different. For example, if you have acute bacterial prostatitis, which is an infection of the prostate, your doctor might suggest avoiding sexual activity, including masturbation, until the infection clears up. This gives the inflamed tissue time to heal without additional stimulation that might worsen symptoms. Men who have recently had prostate surgery should follow their doctor's advice about when it's safe to resume sexual activity, including masturbation. Depending on the type of surgery, there might be a healing period where ejaculation could interfere with recovery or cause discomfort. This is especially true after procedures like prostate removal or radiation therapy for prostate cancer. It's also important to note that while regular masturbation might have health benefits, excessive masturbation that causes physical discomfort, skin irritation, or interferes with daily life could be problematic. If masturbation becomes compulsive or starts to negatively impact your relationships, work, or other aspects of life, it might be worth speaking with a healthcare provider or therapist. Some men notice changes in their ejaculation as they age, or if they have prostate issues. This might include less fluid, different sensations, or even pain. These changes could be normal signs of aging, but they could also indicate a health problem that needs attention. Have you noticed any changes in your ejaculation patterns or sensations? If so, these observations can provide valuable information for your doctor. For men taking certain medications, particularly those that affect hormone levels or blood flow, the effects of masturbation might be different. Some medications for prostate conditions, like alpha blockers or 5-alpha reductase inhibitors, can affect ejaculation. If you notice changes after starting a new medication, this is worth discussing with your doctor. It's also worth mentioning that while masturbation itself doesn't cause sexually transmitted infections, men who have certain infections should be careful about touching their genitals and then touching other parts of their body or other people. Proper hand washing before and after masturbation is always a good practice for hygiene reasons. So what's the bottom line when it comes to masturbation and prostate health? The evidence suggests that regular ejaculation, whether through masturbation or sexual activity with a partner, may be good for the prostate. But it's just one piece of a larger health puzzle. Taking care of prostate health involves many factors beyond sexual activity. A balanced diet rich in fruits, vegetables, and healthy fats can help support prostate health. Foods like tomatoes, which contain lycopene, and those rich in omega-3 fatty acids may be especially helpful. Limiting red meat and dairy products high in fat might also reduce the risk of prostate problems. Regular exercise is another important factor in maintaining prostate health. Physical activity helps control weight and reduce inflammation throughout the body, which can benefit the prostate. Even moderate exercise like walking for 30 minutes most days of the week can make a difference. Staying hydrated by drinking plenty of water throughout the day helps maintain overall urinary tract health, including the prostate. Proper hydration helps flush toxins from the body and keeps the urinary system functioning well. Regular checkups with a doctor become increasingly important as men age. Starting at age 50 or earlier for those with risk factors like family history, men should discuss prostate screening with their doctor. These screenings can help catch problems early when they're easier to treat. Managing stress is also important for overall health, including prostate health. Chronic stress can weaken the immune system and increase inflammation in the body. Finding healthy ways to relax and unwind, whether through meditation, hobbies, or spending time with loved ones, can help reduce stress levels. For men experiencing prostate symptoms like frequent urination, difficulty starting or stopping urination, weak urine flow, or pain during urination or ejaculation, it's important to see a doctor. These symptoms could indicate various conditions, from simple infections to more serious issues that need treatment. Remember that what works for one person might not work for another. Each man's body is different, and health needs change with age. What's most important is paying attention to your body, noticing changes, and having open conversations with healthcare providers. Masturbation is a normal part of human sexuality, and the research suggests it may offer some health benefits for the prostate. The key is moderation and balance, as with most aspects of health. By combining healthy sexual habits with good nutrition, regular exercise, proper hydration, stress management, and regular medical checkups, men can support their prostate health throughout life. Now tell me, what's one thing you'll do differently after watching this video? Please share with us in the comments. Thank you for watching, and see you in the next video.